And it's great that you talk about access, because a lot of our clients are really asking, as an expat, what is my kind of access to the healthcare versus a PR or versus a Singapore citizen? I think these are all very important questions they're asking. Would you be able to explain a little bit more about that?
Okay, the slightly different for Singapore citizens and PR, actually they are in the same category. Singapore citizens and PR both actually have subsidized care. So Singapore actually the government heavily subsidized our residents, whether PR and Singapore citizens, in terms of our government facilities. Singapore's healthcare structure is actually made up of the private sector as well as the government sector. So the government hospitals, including NUH, Tan Tock Seng Hospital, SGH, Singapore General Hospital, etc., these are all run by the government system. So the government system actually provides patients or the residents in Singapore and the PRs actually a heavy subsidized up to 80%. But of course they have a choice. They can also go for private and opt for private. Whereas for the expats or the foreigners, they are generally actually in the private, and they also have to pay private rates if they were to go to government hospital. So there's actually a difference. For private wise, a lot of time, if you're willing to pay, you will be able to get immediate attention. Whereas if you are subsidized care, it will take a while. There may be some waiting time, for the referral to take place, and also waiting time at the subsidized care.
Thank you so much for the explanation. I think it's really clear to us that we are looking at healthcare in Singapore as one of a priority, be it you are an expat or a PR or a Singapore citizen. I think there's various pathways that you can do, but definitely from our side, we will say that becoming a PR or a Singapore citizen, there's definitely benefits to that. Having said that, in the government healthcare and all. Yeah, thank you so much for that.